The Mississauga-Halton Central West Regional Cancer Program oversees the delivery and quality of cancer services for residents of both the Mississauga-Halton and Central West regions. Cancer care and support is delivered through its partners of care. They are Trillium Health Partners, which is the administrative lead for the Regional Cancer Program, Halton Healthcare Services, Headwaters Healthcare Centre, and William Osler Health System. Welcome now to the Carlo Fidani Regional Cancer Centre at the Credit Valley Hospital, Trillium Health Partners.
In this production, we will provide you with an overview about prostate cancer, the factors used to decide what treatment options are best for you, a summary of the various treatment options for men with prostate cancer, and how having prostate cancer may impact your emotional health, relationships, and sexuality. We hope that providing you with this information will help you to feel better informed about your treatment options and cancer care. We suggest that after watching this production, you write down any questions you may have and bring them to your next appointment.
Let's now talk about the prostate. The prostate is part of the male reproductive system, which also includes the seminal vesicles. It is located in front of your rectum and just below your bladder. The prostate adds nutrients and fluid to the sperm ejaculated following orgasm. Branches of nerves that are responsible for erectile function surround the prostate. A flexible tube called your urethra runs through the prostate and is responsible for taking semen and urine out of your body.
There are many types of treatment used for prostate cancer. Here is an overview of the factors used in making a recommendation about which treatment is best for you.
There are 4 factors that are usually used to guide a decision about which treatment is best for you. T, tumor stage, PSA, prostate-specific antigen level, Gleason Score, and your preference.
The tumor stage is the extent of the prostate cancer. T1 cancers are inside the prostate and cannot be felt. T2 cancers are inside the prostate but have formed a lump that can be felt on physical examination. And T3 or T4 cancers have grown into or invaded the tissues outside the prostate.
PSA, prostate-specific antigen, is a protein molecule that is produced by cells in the prostate. It can be found in the blood using a blood test. Cancer in the prostate usually causes the PSA level in the blood to rise. A high PSA does not necessarily mean you have prostate cancer.
The Gleason score represents how aggressive prostate cancer cells look when seen under the microscope. The pathologist, a doctor looking at the samples from your prostate, will examine your cancer closely and give you a score out of 10. The most common Gleason scores for those with prostate cancer are 6, 7, 8, and 9. The 3 factors outlined earlier, T stage, PSA level, and Gleason score, are then used to classify patients with prostate cancer into 3 groups: low risk, intermediate risk, and high risk. Your doctor will explain which group you are in and what that means for your treatment options. Following is a summary of the various treatment options available. They include surgery, external beam radiation, brachytherapy, androgen deprivation therapy, active surveillance, and watchful waiting. The following is an overview of what surgery is, how surgery is done, what to expect during and after surgery, as well as side effects from surgery. If you are in good health and your cancer has not spread outside the prostate, then you may be considered a candidate for surgery. Surgery completely removes the prostate gland, seminal vesicles, and a portion of your urethra. This surgery is called a radical prostatectomy. If your cancer is within the prostate, the surgeon may be able to perform a nerve-sparing surgery to preserve the nerves that control erections. This surgery can be done open, laparoscopically, or robotic-assisted laparoscopically. If you have an open surgery, there will be one small cut, also called an incision, about 7 to 10 centimeters in length, made from between the belly button and the pubic bone. If you have the surgery done laparoscopically, there will be 4 to 5 1-centimeter cuts made in the abdomen. A video camera and surgical instruments are used to view the prostate and perform the surgery. A robot-assisted surgery is similar to laparoscopic surgery, but the instruments are held by the robotic arm and controlled by the surgeon remotely. The control of cancer is the same for all 3 types of surgeries. Discuss any questions you have about the differences in outcomes related to cancer for each type of surgery with your surgeon.
Your surgery will take 2 to 4 hours, and then you will spend 1 to 2 hours in the recovery room. When you wake up, you will have a catheter to drain your bladder. You may spend about 3 to 4 days in hospital so that your pain can be managed before going home. You will go home with a catheter in your bladder, and this will remain in place for up to 2 weeks. This is so the area between your urethra and bladder can heal. It will take 4 to 6 weeks for you to recover. After the surgery, you may experience side effects. Some short-term side effects you may experience are discussed next. With the catheter in place, you may feel the need to urinate often and urgently. Medications can be prescribed to relax the bladder to help with these problems. Once the catheter is removed, you may urinate more often or leak urine. This will get better from the moment your catheter is removed, but be aware that full recovery can take up to a year. You can speed up this process by strengthening your pelvic muscles by doing Kegel exercises. Some surgeons recommend starting these before surgery. You can get more information about Kegel exercises from your healthcare team. You may have constipation from the anesthetic, pain medication, and immobility. It is important to practice deep breathing and be as mobile as possible in hospital to help prevent any side effects such as pneumonia or blood clots in your legs. Erectile dysfunction is the most common side effect of surgery. This can occur if the nerves located near the prostate are damaged or removed during the procedure. The surgeon will try to spare the nerves, but it may not be possible if the tumor is too large or too close to the nerves. Within a year after surgery, 50% of men whose nerves are spared will likely have their erections return.
Some long-term side effects that you may experience are discussed next. 10% of men may leak urine when coughing or sneezing, and even a smaller percent of men will have permanent urine leakage which may be surgically fixed. You may have difficulty passing urine due to scarring of the urethra. This can be corrected with a minor surgical procedure. About 50% of men may have some level of permanent erectile dysfunction. There are medications or procedures that may help with this.
Now let's discuss how external beam radiotherapy is given, how it is prepared, and the side effects you may experience. Treatment is given by painless beams of radiation directed at the prostate from outside your body. You will lie on a treatment bed while the radiation machine, a linear accelerator, rotates around you. You will not feel or see anything entering your body during treatment, like when you get an X-ray.
You will be given special instructions on how to prepare your bladder and bowel for treatment. You may need to have 3 special marker seeds inserted into the prostate. The procedure for inserting the marker seeds is very similar to having a prostate biopsy. You will need to have a planning CT scan done in the radiation therapy department. The purpose of this CT scan is to identify the prostate and surrounding tissues so that the treatment can be given accurately and safely. You will have tiny tattoos placed on your skin that are permanent. These will help the radiation therapist know exactly where the radiation needs to be directed. Using the information above, your treatment plan is prepared in such a way that the correct dose of radiation is given to your prostate while minimizing the dose to the surrounding tissues. Because the planning of your treatment is complicated, there will be a delay of several days to weeks between your planning CT scan and the start of treatment. Use this time to rest and eat a healthy diet. You can always speak to one of our dietitians if you have questions about your diet.
Radiation is a local treatment that, in addition to killing cancer, causes side effects in the surrounding normal tissues. The treatment is planned very carefully to minimize harm to healthy tissues. You may experience immediate and long-term side effects. Many men get through their course of treatment with minimal side effects. Typically, external beam radiotherapy treatments are once a day, 5 days a week, for about 7 to 8 weeks. During the first few weeks of treatment, most men experience little or no side effects. However, you will likely experience fatigue as treatment goes on. Due to the closeness of the bladder and bowel to the area receiving radiation, you may also experience other side effects like an increased urge to urinate, as well as burning when you urinate, an increased urge to have a bowel movement and some discomfort when passing stool, and mild redness and itchiness of the skin around the anus. During radiation therapy, you will be seen once a week by your radiation oncologist and radiation nurse. They will help you cope with any side effects. Many of these side effects are mild and may be helped by changes in your diet or medications. Other than fatigue, these side effects will likely go away on their own within a month of finishing treatment. Fatigue peaks after radiation is finished and can last for several months.
Long-term side effects show up months or years after treatment ends. Although some may sound alarming, it is important to remember that they only happen in a small percentage of men receiving this treatment. Great care is taken in the planning of radiation to reduce the risk of these side effects from happening. The most common long-term side effect from external beam radiation therapy is a change in bowel and bladder habits, such as wake up at night to urinate more often, have a slow urine stream, have more frequent bowel movements or your stools may be formed differently than before, have blood in your urine, and have difficulty passing stool. For most men, these side effects do not affect their quality of life. Difficulty having an erection following radiation therapy is a long-term side effect that is experienced by about 1/2 of the men receiving this treatment. Talk to your healthcare team about options to help with this. One long-term side effect to highlight is bleeding from the rectum, which is seen in about 5 to 10% of men after radiation. The bleeding is usually minor, but very occasionally needs to be treated with a laser procedure to stop the bleeding. In younger men, there is a very small risk of the radiation causing cancer in another area such as the bowel and/or bladder. If you are still considering having children, talk to your healthcare team about the possible impact of radiation on your fertility. Now let's discuss how brachytherapy is given, what you need to do to be prepared, and the side effects you may experience after brachytherapy.
Brachytherapy is when a radioactive source is placed into or close to cancer. There are two types of brachytherapy: low-dose radiation, also called LDR, and high-dose radiation, also called HDR. You will be asleep during both types of brachytherapy treatments, as you will be given a general anesthetic. Brachytherapy treatments can be about 3 hours long. You will go home the same day of your treatment. LDR brachytherapy involves putting 80 to 100 radioactive seeds into your prostate. Each seed is about the size of a grain of rice. The seeds are inserted using needles which hold multiple seeds. Each seed releases a low level of radiation steadily over a number of months. These seeds will stay in your prostate permanently. You will be radioactive for about 12 months after the implantation of the radioactive seeds. HDR brachytherapy involves temporarily putting 12 to 18 needles into your prostate during treatment. A radioactive source is put in these needles and delivers a high dose of radiation to your prostate. After the treatment, the needles are removed. You will not be radioactive after HDR brachytherapy.
If you are receiving HDR brachytherapy, you will not be radioactive after the treatment is done. If you have LDR brachytherapy, where permanent radioactive seeds are used, sometimes very small amounts of radiation can reach other people, as it travels through air or when a seed is passed while urinating or ejaculating. Because such a small amount of radiation is involved, it is not considered a risk to other adults. However, small children are more sensitive to the effects of radiation. We suggest that small children not sit on your lap for 6 months after you have the seeds inserted. Your physician will discuss the potential side effects of radiation with you further. Ask your doctor any questions you have about the safety related to brachytherapy. During the brachytherapy procedure, an ultrasound shows the radiation oncologist where your prostate is and guides the placement of the radioactive seeds or needles. Needles are put through the skin between the scrotum and anus, and ultrasound images help guide them to the right place. After the treatment, you will be taken to a recovery room while you wake up. You will need to urinate before you go home, or you will be sent home with a catheter left in place overnight or longer. Once you go home, you can eat normally, have visitors, and get back to normal life. Your doctor will give you specific instructions to follow when you go home.
Right after the treatment, you will likely have soreness, swelling, and possibly bruising where the needles were placed. These side effects are mild and only last for a couple of days. Your doctor will prescribe pain medication if you need it. Some side effects may be experienced in the first couple of days after the treatment. Your doctor will tell you to drink plenty of water to help with these symptoms. These symptoms include slight bleeding or burning behind the scrotum or blood in your urine. These side effects are normal and are not a cause for concern. You may also notice blood or brown semen for several ejaculations after brachytherapy. You may also experience frequent, urgent, or uncomfortable urination and feel like you have to empty your bladder but are not able to do so.
25 to 35% of men who have brachytherapy will have changes in their erectile function. There are medications and procedures that may help. There is a small chance of bowel injury causing bleeding, having more frequent bowel movements, or having stools that are formed differently than before. There is also a small chance that you will wake up at night to urinate more often and have a slow urine stream. Be sure to discuss any concerns or questions with your radiation oncologist. The following discusses what androgen deprivation therapy is, when it is used, and the side effects you may experience.
Hormones are chemicals produced by your body that influence bodily functions and mood. Male hormones are also called androgens. Testosterone is the main hormone that acts as a chemical fuel for the prostate and prostate cancer. One way of attacking the cancer is to remove this chemical fuel. Androgen deprivation therapy, also called ADT or hormone therapy, is used to prevent the testicles from producing testosterone. A common myth about ADT is that it involves giving female hormones, but this is not true. Hormone therapy alone does not cure prostate cancer, but it can slow or stop cancer growth for many years.
Hormone therapy may be given by your doctor for the following reasons. Before giving radiation or surgery, to try to shrink your prostate if it is larger than normal. In combination with radiation, if you have a high-risk prostate cancer. If surgery and/or radiation is not an option because your cancer has already spread outside of the prostate. Or if your prostate cancer comes back after treatment with surgery and/or radiation. The common physical side effects of ADT are fatigue, loss of sexual desire, weight gain, hot flashes, breast tenderness, genital shrinkage, as well as gradual decrease in body hair. Other side effects include feeling the ups and downs of emotions more than before. Your healthcare team can help with this. If given for a long period of time, hormone therapy can cause weakening of your bones. As a precaution, your doctor may have you take calcium and vitamin D. Your doctor may also have you take a test which measures the density of your bones. ADT can also increase your risk of developing diabetes, heart disease, and anemia or low blood counts.
Now let's discuss what active surveillance is, what to expect, and the advantages and disadvantages of it. This option is given to patients with low-risk cancers confined to the prostate and unlikely to spread. Active surveillance is not providing any radiation or surgery at this time. Rather, it is actively monitoring your prostate cancer until there are changes. For men on active surveillance, radiation or surgery may be offered in the future if there is progression of disease.
Active surveillance involves blood tests for PSA with a rectal exam every 3 to 6 months. your doctor will usually recommend you have a repeat biopsy 12 to 18 months after your first biopsy, or if there are changes in your PSA tests and/or rectal exam. If the cancer starts to change, your doctor will recommend active treatment such as surgery, radiation, or hormone therapy. If changes occur, you may be sent for further tests to find out the extent of the cancer. Advantages. You can avoid invasive treatment and the side effects. Your quality of life may not change. Disadvantages. Feeling anxious about the cancer not being treated or progressing. There is a small risk that the cancer may get worse. The inconvenience of frequent follow-up appointments and tests. This is a choice given to men diagnosed with prostate cancer who have other medical issues that could cause more problems for them than the prostate cancer. If this is an option for you, your doctor will tell you more about it. Even after active treatment is completed, your doctor will continue to regularly monitor your PSA for any changes. Why do I need to have my PSA checked when I have had my prostate removed? Your PSA should be 0 after your surgery. A rise in the PSA may indicate that there are still cancer cells in your body and/or that the cancer has returned. Why do I need to have my PSA checked when I have had radiation? The PSA test is the best way to monitor the response of radiation. After radiation, the PSA rarely goes to 0, as there is still normal prostate tissue remaining in your body. The goal is to see a drop in the PSA after radiation. A rise in the PSA may indicate that there are still cancer cells in your body and/or that the cancer has returned. The following answers common questions about emotions, relations, and sexuality many men and their families ask. What may I be thinking and feeling after being diagnosed with prostate cancer? You can expect to feel a range of emotions and to have a variety of thoughts after your diagnosis. These may include sadness, guilt, anger, and relief, to name a few. You may wonder how this happened or why this is happening to you. How can I cope with these thoughts and feelings? People tend to cope better when they allow themselves to acknowledge whatever emotion they are feeling at the time. When you get upset with yourself for feeling a particular emotion, it can make it harder to cope. Do your best to be positive, but be kind to yourself if it is a struggle at times to remain positive.
How will having prostate cancer affect my relationships? Having cancer can create changes to the roles in your intimate relationships and your relationships in general. Others may need to temporarily assume roles you have filled in the past. These changes may be difficult for you or your support network, that is, the people who provide support to you. Clear and open communication can help both yourself and your support network move through these changes with less difficulty. What if I or my support system want to talk to someone for help with coping or changes to our relationship? There is a lot of help available for you and your support network. Your family doctor is an excellent support. You may also find going to agencies that provide assistance to those with prostate cancer helpful, such as Wellspring and Prostate Cancer Canada Network. We also suggest you look at the Cancer Centre's patient education calendar of events to see what programs might interest you. You can also talk to your healthcare team about meeting with a member of the psychosocial team who can connect you to individual, family, or group supports either at the Cancer Centre or in the community.
I just want to focus on my treatment now, but how can I get help when I want to start thinking about resuming my sexual activity? This is a very common question. We know you may not feel comfortable talking about this, but we welcome questions about it. Treatment for prostate cancer has a chance of causing changes to erectile function, ejaculation, and sensations, as well as a loss of desire and feeling different about your body. Experiencing these side effects may affect both your sex life and your relationship with your partner if you have one. Open communication can help, as well as seeking support from your family doctor or the psychosocial team at the Cancer Centre. Does being sexually active cause the cancer to grow? No, there is no evidence that sexual activity affects the growth of prostate cancer. We have reviewed information about prostate cancer, the factors used to decide what treatment options are best for you, a summary of the various treatment options for men with prostate cancer, and how having prostate cancer may impact your emotional health, relationships, and sexuality.
We hope this information has been useful to you as you prepare for your cancer journey. If you have questions or concerns about the information, please contact your healthcare team. Thank you.